Okay, so this person posted saying that her husband is having dripping on one side of his mouth, trouble finding words, slurred speech, and his right hand isn't working properly. So this is a stroke until proven otherwise. A stroke happens when blood flow to the brain is suddenly cut off. 85% of strokes are ischemic, meaning that a blood clot blocks an artery, kind of like a plug in a pipe. And 15% are hemorrhagic, meaning that a blood vessel bursts and leaks blood into the brain. Every minute that passes, 1.9 million brain cells die, so every second counts. And this is why we say time is brain. The easiest way to recognize a stroke is by using FAST. Face drooping, arm weakness or clumsiness, speech difficulties like slurred speech, trouble finding the words or trouble understanding, time to call 911. If you come to the ER with stroke symptoms, we would start by inserting an IV and send you immediately for a CT scan with IV contrast to look for a clot or a bleed. If we do find a clot, we would call a stroke neurologist and consider giving you a clot-busting drug called TPA. Sometimes if the clot is large and in one of the main arteries, we can perform a thrombectomy. And that's where we pull the clot out using catheters under live X-ray guidance. If we find a bleed on your CT scan, unfortunately the damage to your brain cells where the bleed is already done, so we focus on damage control or damage mitigation by controlling your blood pressure, reversing blood thinners, and we'll often call neurosurgery, but they typically don't operate on these. During a stroke, everything is about speed because the faster we restore blood flow, the more brain that we can save. So share this with a friend or a family member because it could save their brain.